My name is Melissa Gargiulo. I am a hospice nurse. I love what I do. And when people ask me, what do you do? And I say, I'm a nurse, and they say, well, what kind of nurse? I say, well, I'm a hospice nurse. It's always, oh, how can you do that? But for me, I can't imagine being any other kind of nurse. I mean that. For me, the joy that comes with helping a patient whose body is failing, and also surrounding the caregivers and everyone around them, and bringing them in, and taking this really sad situation and making it better. There's just such a joy that goes with that. I can't express it. I am blessed to be a hospice nurse. If you're watching this video, then I think that someone has probably mentioned hospice to you. It may be you as the patient. It may be someone that you love. And you're thinking, oh, I don't want hospice. I'm not dying. My mama, I'm not giving up on her. You're thinking all of these things, and it's really normal. And I've done it myself because everyone in my immediate family has been on hospice. So I have been in your shoes. I've had to make that emotional leap to accept that someone I love is going to pass away. And that's the hardest thing. Actually, it's the only hard thing about hospice, is making that leap. Because once you get on hospice, it's wonderful. we help with so much that you don't even realize is hard. We come in and we say, would you like us to do medications for you? I mean, if you want to do it, you can, but if you want, we can take that responsibility from you. And then all of a sudden you have this pressure taken off of you, and we have bath aides that can come help you get cleaned up or help clean up the person that you're taking care of. And there's social workers and chaplains. There's just this whole team, and you become the center of that team. And that's one of the misconceptions is, if I go on hospice, I'm giving up, but you're not. You're not at all. You're doing exactly the opposite. You're getting so much more help for this person whose body is beginning to fail. Now that you kind of understand a little bit about hospice, lung disease, it's so hard to watch someone not be able to breathe. It is a very, very sad disease to have, and it can go on for a long time. If you're watching this and someone has mentioned hospice to you because of something that's going on in your lungs, this is what they've probably been noticing. Or if you're just wanting information, which, by the way, good for you for finding information before you actually have to have it. If you're just wanting information, these are some of the things that you're going to see happening in your body or the person that you're taking care of. That means you might be appropriate, ready for hospice. And that word, don't let that word scare you. It's just a word. Throw it out the window. Just concentrate on the stuff that comes with it. If you find that the person that you're caring for, is having a hard time breathing and talking at the same time, they might do short little sentences and then have to stop and catch their breath. Or you notice them doing this. It's called pursed-lipped breathing. And by the way, if they're doing that, good for them. You've got a good health provider who taught you how to do that. I'm glad you've got that kind of support. It's a really good thing to do. But if you're seeing that, and you're noticing that you are now dependent on oxygen. Someone said, wow, your O2 sats are kind of low. If no one's explained that to you, when you breathe in and your blood fills up with oxygen and it's circulating your body, which is really important, the parts of your body that are the furthest from your heart, your fingers and your toes, if there's less oxygen getting around, that's where it's going to be able to be found. So when they put that little thing on your finger and they go, oh, your O2 sat's 96, or oh, your O2 sat's 84. That's what they're talking about. It's the amount of oxygen in your blood. It's acceptable and it's okay and normal to have oxygen levels above 90%. If it goes lower than that, then someone's probably going to say, I think you should be on oxygen. And everybody is different. One of the things that we look for as hospice to see if someone qualifies for all this amazing hospice care with a diagnosis of lung disease is if your O2 sat, when they check it on your finger, is 88% or less when you're just on room air without any kind of oxygen support. A bigger indication is if it's less than that when you have on oxygen. What this means is your lungs are working, your heart is working, but something is not working correctly in your lungs and you cannot absorb enough oxygen and feed it around to your body. That's what it means by low oxygen levels. Another thing you might notice is that you're beginning to lose weight. And that is because you literally cannot eat and breathe at the same time. And you can be drinking nutritional support and little snacks, but your body is beginning to lose weight. And a lot of that is because you are spending so much effort and burning so many calories just to be able to breathe that you need to consume more to keep up with all those calories that you're burning. So you're going to start to lose weight. You're also going to notice that you're going in and out of the ER more. You wake up in the middle of the night, you can't breathe, you get scared, your anxiety goes up, it's harder to breathe, and then you end up going to the ER. Another thing we look for is infections. Unfortunately, because your lungs are fragile, this person you're taking care of, their lungs they have a disease, they don't work as right. They're very susceptible to getting pneumonia. If someone has a cold, a flu, if they get a little bit of water down in their windpipe, maybe, it's very easy to get pneumonia. All of these things, this overall decline, not sleeping as much, not having as much energy, not being able to walk from the couch to the bathroom, having to stop and take a few steps and stop and rest. All of this is indication that your lungs are starting to fail. And that's a really hard thing to hear. And I'm sorry that you're hearing it over a video from someone that you don't know, but that's what that is. And when that happens, that's when you can think, okay, maybe I should be evaluated for hospice. Just an evaluation. If you don't meet criteria, they're going to give you great support. They're going to connect you with resources and you don't have to do anything else. But if you are, then they're going to offer you hospice and all the amazing stuff that goes with it. I'm encouraging you. This is a really big step. If you think you might be appropriate or you just want more information, call Intrepid. Let us talk to you. Let us connect you with resources. We're not going to push. We're just here to help. I know I've thrown a lot of information at you. You don't know me. I just want you to know that I'm talking from my heart. Good luck to you, and I hope things work out the way that you want.